How can staff be more deaf aware in healthcare services? Our 5 top tips. Top tip 1. Text message response times. I've got one tip for you. What we should do is when we're getting text messages, we need to get a response. When we send a text message to you, we need a response because that helps us. So when we're booking appointments, we need to book them and we'll text it to you. We need a response to understand that you've got that text message and the same day, not delayed, but on the day we send the text message. And if you're asking me if I want an interpreter, that's really important. That needs to be in the text message also and confirmed to make you aware of deaf needs and deaf awareness. So thank you for that. Top tip 2. Simple appointment letters. Hospital letters for appointments are important letters, and they're posted out to deaf people who receive this letter. There's an awful lot of information which deaf people don't understand because it's in their second language. So they have to go to their mother and father or to a deaf centre and ask for a translation and help understanding the content. And they'll explain that it's an appointment letter and where the date of the appointment is and the place of the appointment. So it's too much information which isn't needed. For an appointment letter, you only need a very brief amount of information. 4 main important things. It should say that you have an appointment and it's an appointment letter, it's not a diagnosis. So it should say the date of the appointment clearly and the time of the appointment and the place where the appointment's going to happen and the fact that a BSL interpreter has been booked. And then if it's a male or female, and give the name of the person. And that's it. The information needs to be very brief. We don't need all that extra jargon because that provides confusion. So a very brief 4-statement letter is enough. So that's it. It's easy. And then the deaf person can understand the information and take the letter with them and be less stressed. Thank you. Top tip number 3. Interpreter double booking. When we're booking interpreters for an appointment, I want to talk about double booking. Recently, I arrived at a hospital, at Salford Royal Hospital, and I asked at reception where was the interpreter. The receptionist said, yes, an interpreter has been booked. I said, okay, so I'll sit down and I'll wait. And I was waiting for some considerable time. And as the appointment time got closer, the interpreter, a lady, finally arrived and come into the hospital, apologising, saying she was really sorry for being so late, but she'd been double booked. She'd had a phone call the previous night and had to go to an appointment that she must attend in Yorkshire. And she was quite stressed by this, having to choose between the 2 appointments. So she'd been to Yorkshire, finished that appointment, and then drove all the way to Salford Royal. And she was quite out of breath and flustered by this. Really, my tip is that if you're going through an agency, to make sure that the interpreter isn't double booked. They should never be double booked. Contact the booking and make sure, it's not fair on the deaf people. It's the stress caused by waiting and wondering if that interpreter is going to arrive. And you need to be calm before your appointment, with the interpreter arriving in good time and ready to meet you before the appointment happens. So that way both people are happy. So double booking, I don't think is a good thing, and it's a shame for the interpreter and it's stressful for the deaf patient. So it's a very difficult way. So please only book the one interpreter and give them time, an appropriate amount of time, just the one appointment so they can arrive in time. Please do not double book interpreters. Top tip number 4, beat the queue and visual alerts. When deaf people and need an appointment in the GP, it's really good to use the beat the queue, because the interpreter's time is quite precious and both of you need to be at the appointment on time. So a quick response and get a conversation is good. Because the doctors give 10-20 minute appointments and the interpreter's time is quite precious, so you need to be in and make sure they can both get in. 30 minutes is a long time. So it's good when you arrive at the doctor's if you can beat the queue and get in on time so that you use the interpreter and the patient's time effectively. Also, if you've got a visual display, the deaf person can be aware of when the appointment time is. They've got access to information that they would otherwise miss. Deaf people, when they arrive at a GP surgery, you need to make sure that the doctors need to make sure that there's a visual alarm system. So on the walls of your surgery in the waiting room, you need to have a flashing alarm system that's accessible to deaf people while waiting in the waiting area. If the alarm is blocked by walls and the structure of the building, then you need more than one visual alarm, because the deaf person must have a line of sight to see the alarm is actually flashing. So you must make sure that there's a visual alarm and it's accessible to deaf people. Top tip number 5, good practice for interpreters. Make sure that the interpreter arrives early, 10 minutes before the appointment, because when deaf people arrive, they want to see that there's an interpreter there, and it saves them the stress. They understand the interpreter's available, and they can also have a conversation regarding the problem that they're bringing to the doctor and the situation, and they can talk about this before they go into the GP surgery, so that both are on a level playing field before the appointment.